The American Heart Association a couple of years ago had an initiative basically informing doctors that they really need to think about heart disease in the female patient population earlier. One of the unfortunate biases that people had is when a guy walked in with chest pain, the doctor immediately thought cardiac issues. Whereas sometimes if a younger woman walked in with similar complaints, they would think GERD or anxiety or whatever. And so I think it's important that the medical staff reflects the demographic they serve. And so having two high-quality, superb female cardiologists is a great thing because we have male cardiologists, we have female cardiologists. Patients may have a preference in that space. And so we're able to provide that, and not just provide it based on gender, but based on super high quality and people who are really dedicated to patient care.
I think, as a woman, it's hard to be in a position where you're vulnerable in front of a man sometimes. Sometimes you feel like a woman is the only other person who would understand what you're going through, even when it comes to, even if you have an excellent male doctor.
The perception has been for a long time that cardiology, heart problems, heart disease, not just male dominated on the physician side, but also patient side, right? It's seen as something that men get. And I think that's really overlooked. And so since we know that heart disease is the leading cause of death for women, I think it's important to have that representation, right? And when we have that here at Cheyenne Regional, so that when women do come in presenting with these subtle symptoms, that there is someone that's ready to listen, someone that's there to understand that this is possibly a serious condition, and to not write everything off as anxiety or stress.
I think in the past what has happened is their symptoms have been ignored or misdiagnosed. And that can be really troublesome because they have a heart attack and then women have died from that. And that's something that's really upsetting to me and something that I take very personally. So any woman who comes to me, I take her symptoms very seriously. Because it's something that may not have happened in the past, and I want to make sure that all my patients are taken care of, men and women, and I want to make sure that that's not missed and that something scary isn't ignored.
Dr. Nirkanda and I are both very in touch with our patients. We care a whole lot. We focus in on just all the different aspects that need to be cared for. And that's important.
This is somebody's aunt, uncle, brother, sister, dad, mom, grandfather. And that's almost a sacred duty to make sure that they're taken care of well and that they recover as much as they can. And so I take it very seriously. I think every single person deserves health care, and it's something that I try to do in my daily practice.
This is the place you want to take your family to because the providers are fantastic, and they're going to care for you the way they would care for their family members.
I consider caring for patients at Cheyenne Regional to be akin to caring for the heart of Wyoming.